Okay, hi, I'm Amanda. I'm your student nurse practitioner. How are you?
Good.
I'm going to test your cranial nerves and then move on a head-to-toe assessment. If at any time you're uncomfortable, you notice any discomfort, tenderness, or pain, let me know, okay? Okay. First, we're going to test cranial nerve 1. Close your eyes and include one nostril. And patient's left, what can you smell?
Orange.
And occlude your left, perfect. And testing patient's right. Great. So I can see that both mirrors are patent. Your nasal bridge is straight while I'm looking at you, and cranial nerve 1 is intact. If I had a Snellen chart, I would test your vision for cranial nerve 2, but I don't. Next, moving on to cranial nerves 3, 4, and 6. You are going to just follow my finger. Perfect. 6 cardinal fields of gaze are intact, and also going to follow my finger in, convergence, and focus on a distant object and then my finger. And accommodation is noted. Next, I'm going to be testing cranial nerve just 3 with the lights off. So this is testing direct response. I also see that corneal light reflex is symmetric. Pupils are equal, round, and reactive to light. And now I'm testing consensual response in the opposite eye. Perfect, consensual response noted. So cranial nerves 3, 4, and 6 are definitely intact. Next, I'm going to test cranial nerve 5, motor, to start with. I'm also assessing TMJ at the same time. So if you just open and close your jaw, perfect, and again, perfect. And close your eyes. This is sensory of cranial nerve 5. Tell me if you feel sharp or soft. 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 Perfect. Sharp. 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 Cranial nerve 5, motor, is also intact. Next, I'm testing cranial nerve 7. Puff out your cheeks and frown and close your eyes really tight. Perfect. And while I'm here, I'm also going to assess your tongue strength just since I'm here. So put your tongue against my fingers. Perfect. It's not really part of the test, but while I'm here. So cranial nerve 7 is intact. Next, I'm going to test cranial nerve 8 with the whisper test. Tell me what you hear.
3, 4. 5, 6.
Gross hearing is intact. If I had tuning forks, I would also test Weber for unilateral hearing loss and Rhine on the mastoid process to test bone and air conduction. When the patient no longer could feel the vibration, I would move the tuning fork in front of the ear and assess for when she no longer could hear anymore. Okay, so that's Weber and Rhine. And then next, testing cranial nerves 9 and 10. If you can stick out your tongue for me and say, ah.
Ah.
Perfect. Okay, so I see the soft palate and uvula raised midline. That's expected. Tongue protrudes midline. No deviations or fasciculations noted. And that's cranial nerve 9 and 10. I can also see that the buccal and oral mucosa are pink and moist, and tonsils are 1+. And next is cranial nerve 10, and you just let your tongue rest in your mouth and open your mouth. Perfect. So no fasciculations, no deviation, tongue rests midline in the mouth. Cranial nerve 12 is intact. And then last, the shoulder shrug is really easy. Just shrug your shoulders. And cranial nerve 11 is intact. Perfect. Next, we're going to move on to a head-to-toe assessment. If you can tuck your hair behind your ears. So I'm just looking at the patient overall head to toe. Patient is normocephalic. Ears are normoset. Appropriate and symmetric facial features, even distribution of hair, full eyebrows, sclera are white, cornea are clear, iris are hazel brown, lips are pink, skin is pink, warm, elastic turgor, breast cap refill less than 3 seconds, no clubbing or cyanosis on the hands, and same for the lower extremities bilaterally. Perfect, since I touched your feet, I'm going to wash my hands. So I'm gonna kind of look, listen, and feel. So next I'm going to palpate your scalp, and then I'm going to do all of your lymph nodes, and then we'll move on from there, okay? Let me know if you have any tenderness. So scalp is non-tender, no deformities, and expected findings. And next, ears, arcles and lobes without tenderness, pigmentation changes, or deformities. And next I'm going to wash my hands again because I touched your scalp. And I can also see that, sorry, settle that. Next I'm going to check your pulses. Okay. So temporal are +2, carotid +2, brachial +2, equal and strong bilaterally, radial +2, and dorsalis pedis, so the top of the foot, and posterior tibial are all +2, equal and strong bilaterally. Perfect. Oh, while I'm down here, I'm going to just check your Babinski reflex. So toes curl and negative Babinski. Okay. Next, I'm going to percuss and palpate your sinuses and all of your lymph nodes. Oh, let me do this really quick. Okay. So I'm going to feel for your lymph nodes, okay? So let me know if you have any tenderness. Preauricular, posterior auricular, carotid, tonsillar, submandibular, submental, occipital, superficial chain, posterior cervical chain, deep cervical chain, supraclavicular, infraclavicular. You can just brush your hands like this. I can also see external rotation and of the shoulders, and axillary, no tenderness, and behind the knees for popliteal. And no lymphadenopathy noted. Next, I'm going to listen for bruits in the temporal and carotid arteries with my bell. No bruits noted in temporal or carotid arteries bilaterally. Next, I'm going to test your range of motion. If you tuck your chin to your chest, so flexion, extend, and side to side. Perfect, no tenderness or anything. And turn your head back and forth. Full range of motion in head and neck. Sinuses. Let me know if you have any tenderness. So no tenderness to percussion of frontal and maxillary sinuses, and now I'm going to palpate frontal and maxillary sinuses, nasal bridge, and close your eyes. External eye, no tenderness? Perfect. No tenderness, deformities, or lesions on inspection and palpation and percussion. Perfect. So next I'm going to check your thyroid. And I can see from lateral view that the patient's thyroid is not visible, which is a good sign. So I'm going to visualize you twice. So once taking a sip, and then once I'm going to be behind you and feeling your thyroid, okay? So just go ahead and take a sip. Trachea is midline, head is erect, and neck is also midline and straight. Go ahead and do it again. Finding the cricoid cartilage, if you could just extend your head up just a little bit while you swallow. Take another swallow. Perfect. And thyroid is not palpable. Okay. So next I'm going to turn off the lights. I'm going to look in your ears and then your your ears and then your nose and your mouth and then your eyes. So I don't have to switch my thing off and on so many times. Okay. My otoscope. Okay, so I already assessed the external ears, and I'm gonna just look at the external canals on my way in with my otoscope. If this was a child, I'd be pulling down on the earlobe. Okay. Perfect. External canals are without deformities, slight cerumen noted, tympanic membranes are translucent pearly gray. I can see the manubrium of the malleus and light reflex. No bulging or retraction noted. And same on patient's right. Oh. Okay, so next I'm going to just take a look in your nose. If I had a nasal speculum, I would actually use that. So no epistaxis noted, no drainage, and inferior turbinates are just visible, and mucous membranes appear pink and moist. And mouth now. Okay, go ahead and say Perfect. Patient has all 28 teeth. I already noted the tonsils earlier. I'm just gonna feel. And feeling the tongue. Oral and buccal mucosa are pink and moist, without lesions and no fissures of the tongue, or lesions or fissures on the tongue. Next, I'm going to be looking in the eye. I already noted everything for the external eye, and I see that your palpebral fissures are without ulcerations, erythema, or exudate as well. You can just look straight forward, yeah. Red reflex is present. Sorry, I'm moving so close. And one more time, is that making your eyes warm? Okay. Red reflex is present bilaterally. Cup to disc ratio is appropriate. Arteries and veins are branching, or vessels are branching away from the optic disc. The optic disc is yellow with well-defined borders, which is expected. And the arterioles are smaller than the veins or venules, and the ratio is 2 to 3, which is appropriate. Let me turn on the lights. I also forgot to mention that the fundus is pink with yellow optic disc, well-defined borders. Okay. I think for a second. Okay. So next we'll move on to I'll listen to your heart, or excuse me, your lungs, and then we'll finish up with some range of motion, and then I'll get you up, and then we'll put you on the table. Okay? I'm gonna take time. Perfect. Okay, so just looking at the patient, she is not using any accessory muscles for breathing. She does not appear dyspneic. Again, I checked skin turgor, and skin is also appropriate. I checked that earlier. So if I'm just going to take a look at your chest. So AP transverse lateral diameter. It appears about 1 to 2. I'm just going to check that really quick. Oh, actually, you know what? If I could just have you turn a little bit to face outward. Perfect. Now I'm going to take a listen. Okay. Not so many times. Fantastic, and I'm going to percuss. So I hear clear lung sounds over the anterior and all 4 quadrants. And then I'm going to test or listen to lateral lobes, 2 on the left, 3 on the right. Just a little bit. Perfect. And if you can just turn so that your back is facing the camera. Yes, beautiful hair. I also note on patient's skin the tattoos, and I will note that in my charting. All lung fields are clear to auscultation. Resonant lung sounds posterior, and now I already checked the anterior. So resonant lung sounds over all lung fields, or resonant sounds over all lung fields. Take a deep breath. Equal chest expansion. I'm going to just tap on your back. Let me know if you feel anything or any pain. No CBA tenderness noted. Okay, if you want to just turn back around for me. Almost getting close to the end. Okay. Okay. So next we're going to move on to some range of motion, and I'll also have you stand up and do a few things before we lay down. Okay, sounds good. Okay. And I'm going to do your reflexes really quick. Okay. So checking reflexes. You just relax your arm, put it in, there you go. And triceps, 2 plus. Bilaterally, did I actually do that? Good.
Oh, you're fine.
Biceps, 2 plus bilaterally. Brachioradial, did you feel that?
I can do that.
Did you feel it though? Did you feel it, Jer? Yes. Okay. And brachioradial, 2 plus, patellar. There we go. Maybe a little bit more than 2 plus on that one, and then Achilles. Relax. You feel relaxed? You're like, no. You're about to go on vacation. Okay, and Achilles are also 2 plus bilaterally. I felt for popliteal pulses. Okay. And okay, so next we're going to test some fine movement and coordination. So if you can, one at a time, just touch your and then we'll switch.
Okay.
Okay, so touch your finger to nose and then my finger. Perfect. And now swap. You're like afraid that you're going to be bad at it. Perfect. Okay. And I know we already did this earlier, but external rotation, internal rotation. Perfect. And supination, pronation, radial ulnar, extend and flex. Perfect. And same thing. So abduction, adduction, and if you want to just look here too, perfect. And then you're gonna put your arms up. So tricep strength and push against me, pull, tricep strength, goodness. Pull, bicep strength, push, tricep strength, perfect. And you're gonna squeeze your legs inward against mine. So adduction and then push out, abduction strong, and then push, pull up, perfect. Hip flexors are strong and equal. And then pull in, hamstring, and then push out. Quadriceps are all strong. You're gonna push your feet down, so plantar flex against my hands, and then pull up towards your body, dorsiflex, perfect. All equal and strong. I don't think we missed anything other than maybe some fine movement, which,
There we go.
there we go. Okay, if you wanna hop up, I'm going to have you walk on your tippy toes. And then come back and just walk straight. And come back and walk on your heels. So dorsiflexion. We check plantar flexion with on the tippy toes. And I will have you walk heel to toe.
Okay.
Kind of like a sobriety test. Perfect. Tandem walk is good. And then you can walk normal back to me again. And bend over and touch your toes. Spine is nice and straight. No lordosis or kyphosis noted. And stand up for me. Scapula, iliac, and gluteal folds are all even. So, and patient also has good posture. We are done with all that. You want to hop up here. Okay, so while you're here, I'm going to have you just take your foot, and slide it down your opposite shin. Perfect, well coordinated. Just checking cerebellar function, and then with the opposite foot. Perfect. Okay. Oh, and let me adjust the camera. You're almost there. See if that'll work. Okay. Okay. So now go ahead and tuck your chin to your chest. Any pain with that? Oh, like you're gonna do a sit up. Perfect. No pain?
No.
Awesome. And test them really quick because I just remembered this. Grip strength. Perfect. Nice and strong. So I noticed that the patients, I don't see any pulsations anywhere on the chest. I'm going to listen and then feel, okay? So angle of Louis, second intercostal space, patient's right mid-sternal border, just right of the mid-sternal border is aortic. Sliding over to second intercostal space on patient's left is pulmonic. Just below that at third intercostal space is Erb's point. Just below that at fourth intercostal space is tricuspid. And then mid-clavicular line, fifth intercostal space is mitral. Perfect. I'm going to go back and listen with my bell for dull sounds. In the same spots, aortic. Sliding over to second intercostal space, patient's left, pulmonic. Down to third, Erb's point. Down to fourth, tricuspid. And then fifth intercostal space, mid-clavicular line, mitral. I also will feel for any tenderness, and then also, no tenderness, and then also feeling precordium for pulsations and heaves. This is also my point of maximal impulse, so no pulsations and heaves noted. I upon auscultation, regular rate and rhythm, and I can also hear S2 loudest at aortic and S1 loudest at mitral. So next, just looking at the flat abdomen, no pulsations, well circumscribed umbilicus, and no lesions. And I'm going to listen. Normal active bowel sounds in all 4 quadrants. Next, I'm listening with my bell for bruits and aortic, renal, and iliac arteries. No bruits noted. And percussion. Tympany noted to percussion. And now I'm going to palpate, light palpation. Any tenderness?
No.
Is it a tickle? And deep palpation. Hopefully you didn't just eat. Normally I would do it a little bit deeper, but okay. And perfect, no masses noted. Now I'm gonna feel your liver and your spleen. So patient's right, take a deep breath and breathe out. And no hepatomegaly noted. Take a deep breath and out. And no splenomegaly noted. So no organomegaly noted upon palpation. I think yesterday I said auscultation. I was like, what? Okay. And now I'm going to feel for inguinal lymph nodes. And I don't feel any inguinal lymph nodes, no tenderness, no lymphadenopathy. And now I'm going to listen to femoral pulses. Femoral pulses are +2 bilaterally. And now I'm going to turn my camera just a little bit. And I think I got everything. Yes. And now just leg movement, and then I think we're done. So, flexion, extension, external rotation, internal rotation, and then with the feet, sweep your feet out or like this.
Oh, sorry.
Yep. So eversion, and then inversion. I'm going to put this leg down. Then I'm also going to come over here, turn it just a little bit more so she can see. Also note the tattoo on the foot. And then for the other leg, flexion and extension, external rotation, internal rotation, and inward, inversion, and outward, eversion. Perfect. Full range of motion noted, and we already did upper and lower extremities bilaterally. And now I'm just going to double check really quick to see if there's anything that I missed.
Okay.
Because apparently we're allowed to do that.
Okay.
Okay, sorry I did all that. And are you okay?
Yeah.
Okay, I think we did all that. Yeah, we got everything, or I think so. see if you did all that. Oh, the only thing I think I missed was Bromberg's son. If you want to hop back up, let's see if I have any time.
Yeah.
Which I think you're pretty with it. Oh,